important to know that how Ayurved is different from other pathies and how does it treat the kidney disorder differently. So let's hear it from the renowned, the world famous 5th generation Ayurved kidney expert, Dr. Puneet Dhawan. Welcome, Dr. Puneet.
Thank you. In world we have more than 100 pathies, but Ayurveda is the only pathy which says that you don't get any diseased. The aim or the motive of Ayurveda is said to be swasthasya swasth rakshanam aturasya vikar prashmanam. The primary aim of Ayurveda is for those who are not diseased, who are well, that they should not get any type of disease. And the secondary aim is that those who are having any sort of diseases should get treated. So this is the only pathy which says that those who are healthy should remain healthy. There are about, if you go about 200 years back, there used to be very less diseases, very less number of patients used to be there as compared to number of patients that we are having today. What is the reason behind this? Why is this so? We have started following less of Ayurveda. We have started disowning Ayurveda. That's why the number of patients, the number of cases are increasing day by day. If we go about 500 years back, how many patients used to be there? Very less, to the tune of negligible. This used to be the average number of patients at that particular time. The average age that used to be out there was about 100 to 150 years. If you go about 100 to 200 years back, that used to be the average age, which has diminished now. Why is this so? Why is this happening? This is because we have started following less of Ayurveda. Ayurveda dates back to about 5,000 of years back, 5,000-year-old pathy. This is the oldest pathy in the world. Sushrut, who is known as the father of surgery, is from Ayurveda. He used to perform surgeries about 5,000 years ago, and he used to have so many instruments at that particular time that the number of instruments right now are not even half of it. The instruments that used to be there were used to be made from 7 different types of metals. There used to be 7 different types of metals used so that they doesn't get any kind of rust on it. This was the kind of glory that Ayurveda used to enjoy early. Why is this glory diminishing? Why is this happening? Because we have started following less of Ayurveda. At that particular point of time when two kings used to fight, they don't used to chop off the neck of each other. What they used to do, they used to chop off the nose. So at that point of time, a king who is defeated in a battle has his nose chopped. And there used to be about 1,500 rhinoplasty centers in India at that particular point of time, who used to repair the nose of the king, and he is ready to fight again. So this was the kind of glory Ayurveda used to enjoy at a particular point of time. And we are treating kidney patients from all over the globe through this pathy, through Ayurveda. And we are improving the GFR, the glomerular filtration rate of the kidney. How is that being improved? You can see in the medical reports as well as on the physical level.
Dr. Puneet, as we know that kidney disorders are asymptomatic and in the initial stages you don't come to know about its severity. So what are the tests that are recommended, that are suggested that one should go for, in order to be cautious in the beginning itself?
Look, there are many tests that a patient can go for. For instance, there is a KFT test which used to monitor the creatinine, urea, sodium, potassium, calcium and everything else related to the kidney via blood. And then again there are urine test. Urine test is there for monitoring the albumin that's going through the urine. And then the most important test is that the renal scan DTPA, that's the test meant for GFR, the glomerular filtration rate. How is the GFR improving? How is the kidney function improving? That's meant for this. So as the GFR of the patient improve, if he or she is on dialysis, the dialysis frequency can be reduced and you will see those improvement in medical reports as well as on the physical level. If someone who is not having any dialysis, he can start up the medicines and see the improvements in these reports as well as if there is any kind of swelling in the body, any breathlessness, any nausea or vomiting, these kind of symptoms are there. And because these symptoms are already related to the kidney only. When the kidney is not functioning properly, these symptoms do arise. And when these all kidney function will improve, the symptoms will subside automatically besides the improvement in creatinine urea levels.
Absolutely, Dr. Puneet. And as a layman, people might not be that much aware about how important are the tests and which are the important ones and what are the deciding parameters about their kidney and their kidney functioning. But the way you've explained, I think it's really enlightening and very, very important for all our viewers. So I would really like to thank you for all this. Thank you so much.
Thank you.
So friends, if you have any queries and if you want any further detailings and discussions on this topic of kidney treatment, then please feel free to contact Karma Ayurveda. Dr. Puneet, the 5th generation Ayurvedic specialist, Dr. Puneet with his team will be more than happy to help you and treat you effectively. Do not forget to comment on the box below the video so that we get your feedback and we can interact with you as soon and as much as possible. Do not forget to like and share the video and subscribe to the YouTube channel Karma Ayurveda by clicking on the ring button.